kicked today in the head at practice.
Alright, I'm going to test you for a concussion.
Okay.
Since the patient has walked into the room, we can already assess ABCs. She has an airway, she's breathing, and she has circulation. If I had been called out to the scene, I would immediately assess ABCs and make sure it was not an emergent situation first. Next, I'm going to check for any red flags and make sure it's not an ER case. Do you have any neck pain?
No.
Do you have any double vision?
No.
Any weakness or tingling or burning in your arms or legs?
No.
Do you have a severe or increasing headache?
No.
What about, have you had a seizure or convulsion since it happened?
No.
Did you ever lose consciousness?
No.
Have you vomited?
No.
And then I would also, as the evaluation goes on, I would check for deteriorating conscious state or to see if she's becoming increasingly restless, agitated, or combative. Next, I would hand her a symptom sheet and have her rank her symptoms from a 0 to 6. And then I would start a SCAT-5 test, which would include the cognitive screening, neurological screening, which is when I would perform a BESS or balance test, and then delayed recall test, and then I would make my decision based off her SCAT and her symptom checklist. After going through a SCAT-5 with Jess and coming to my conclusion, I would also want to check her cranial nerves just to make sure that everything is okay. So the first one that I would check is the olfactory nerve, which is cranial nerve number 1, and that is the nerve that controls smell. So what I would do, close your eyes, and I'm going to wave something under her nose, and I'm going to ask her what she smells.
Lemony.
Yes. The second cranial nerve is the optic nerve, and that nerve is the nerve for vision. And so I would ask her, can you see me?
Yes.
Okay. And if she can see and she doesn't have blurry vision, then that would mean that that optic nerve checks out. If we were in the room, then I would have her read from an eye chart just to make sure that she can see everything.
Good.
The third nerve that we are going to test is the oculomotor nerve, which controls eye motor function. So to do so, I'm going to take a pen light and I'm going to shine it in her eyes and monitor her pupil size to see if they constrict or dilate. Next, we are going to perform an H test, which tests the third nerve, which is the oculomotor nerve, the fourth nerve, which is the trochlear nerve, which is also involved in eye motor function, and the sixth nerve, which is the abducens nerve, which is also related to motor control of the eye. So I'm going to do an H test, and what you're going to do is follow my finger with your eye and not your head. We're going to check for the 6 cardinal gazes. Ready? So the next nerve that we are going to test is the 5th cranial nerve, and that is the trigeminal nerve, and that has to deal with the motor control of your mastication muscles. And so I'm going to have her, can you clench your jaw? Smile? Okay. And then we're going to test the 7th cranial nerve, which is the facial nerve. Trauma to the facial nerve could cause Bell's palsy, which is when half of your face goes numb. So tell me if this feels the same on both sides.
Feels the same.
Okay. Next, we're going to test the 8th nerve, which is the acoustic nerve, which is the nerve for hearing. Tell me if this sounds the same on both sides. Okay. Next, we're going to test the 9th, which is the glossopharyngeal nerve, and that is control over your taste and motor function of the pharynx. So I'm going to have her swallow for me. Any problems with that? Okay. Next is the 10th nerve, which is the vagus nerve, and the vagus nerve provides parasympathetic information to certain organs, like your respiratory organs, digestive. So a test that we could do is I could do a gag reflex test on her, but I could just ask if she has had any problems eating or with respiration or anything since she got hit in the head.
I'm not.
Good. Next is the 11th nerve, which is the spinal accessory nerve, which is motor control to the trapezius muscle and the sternocleidomastoid muscle. So to test that nerve, I'm going to do a manual muscle test of the upper trap. Go ahead and shrug your shoulders. Don't let me push you down. 1, 2, 3, 4, 5. Okay. And the final nerve that I'm going to be testing is the 12th cranial nerve, which is the hypoglossal, and that nerve controls motor function of the tongue. So go ahead and stick your tongue out for me, and then move it side to side. Any trouble with that? All right, now we have completed our cranial nerve test, and if our patient was also having neck pain, then I would make sure to check dermatomes and myotomes just to make sure that none of those were damaged when she was hit in the head. And that completes our concussion evaluation.